Dr. Are you able to quickly introduce who is who here? Not in terms of individual names, like what is your role here? Very quickly.
So here some of the staff is belong to board.
As staff nurses, yeah? Staff nurses, yes.
Some are nurses
Yeah.
are there
And the people at the back?
Yes, there are also midwives and some are belong to laboratory and some are
Right, perfect. And over here?
They are midwives and nurses.
Yeah. And you work in
I am the administrator and the pharmacist.
and
He is Dr. Rafi Ahmad Khan and he is
Assalamualaikum. Asim.
head of surgery.
Right.
Finally, below is the director of hospital.
No, I know it very well, yeah. Okay, fine. Let's start, guys. So, as I said earlier, our session today is on, we call it basic life support. Okay? Now, before we start about basic life support, I'm going to ask you first, let's start from what is life and what is support. What does it mean, yeah? So, if we just start from here, what do you think? How would you say what is life? I mean, for example, you are living, you have a life. Let's suppose this dummy, it does not have a life. Yeah. So, what is the difference between you and this plastic dummy? What do you think? What is the difference between you and this dummy? Yeah, but what's the basic thing? What is this dummy does not have what you have? You have, yeah, your respiration, right? Okay, yeah. So your friend here says that all of you are breathing, right? Okay, but this dummy who is not alive, there's no life there. This dummy is not breathing. Okay, so we've said this one thing for life: if you are breathing, you're alive. If you're not breathing, you're not alive. Okay. Name another thing which is different between you and this dummy. In addition to breathing, what else you have and this dummy does not have?
I have sense of feeling.
Something more basic. Pulse. Right, okay, yeah. So we all have a pulse, okay? And the pulse comes from when your heart beats. Okay, so heart beats and you get a pulse, okay? So let's stop here. So we have identified two things. That we all have a pulse because our heart is beating, and we all are breathing, and this dummy does not breathe and doesn't have a pulse, okay? So let's call it that these two things is equal to life for us, okay? So if you lose these two things, that means life is gone. Does it make sense? Okay. So if somebody is losing these two things, or somebody has lost these two things, what you can do to help that person or the patient? You need to bring these two things back, okay? Or as our course is basic life support, so if I say we need to support this person to get these two things back, okay? So if we can support that person to get these two things back, the breathing and the pulse, okay, that is our course, basic life support. Does it make sense? Okay, fine, okay. So let's start from, we're gonna give breathing to this dummy and we're gonna give a pulse or a beating heart to this dummy. If you can do these two things, the job is done. That is all what basic life support means. Happy with everyone? Happy everyone? Makes sense, right? Okay. So in the life support course, what we do is we start from the very first basic thing, that if somebody is in front of you who you think is unwell, or they're not breathing, or they're in a cardiac arrest, or they are dying, they're poorly, also you need to go and see the patient, right? Okay, yeah? The very first thing we always say is, you need to make sure where you're going is an area which is safe to approach, okay? For example, if there's a little fire here, you're not going to jump into the fire to save his life, okay? That will not make any sense, okay? So in the course we always say, is the area safe to approach? That's the very first thing you need to determine. So you all work in this hospital, and all the time, wherever in the ward, in the labor room, as midwives, the nurses, the doctors, wherever you're going in the hospital, always, very likely, the area will be safe to approach. Yeah, happy with that? But that's the first thing done. The second thing is, we need to check for response or signs of life. Okay? So the very first thing we do is, we just go and just check for any response. How you do that is, it's up to you. You can go and say salam to them. You can say hello loudly, and then make sure see what they do. For example, if I come here, if this is my patient who I think is not well, and we will just say loudly, salam, hello, how are you? Just do it loudly. Okay, so they can, if they are sleeping, they wake up. Okay, yeah. If you come here, you shout at them, you say salam loudly, hello, hello, how are you, hello. Just do it loudly. There are only two possibilities. One is they're gonna wake up and they're gonna ask you what's happening, and you can just say salam to them and go away, or like do something else. Or if you do that and they do not respond to you, so that means they are unconscious. Okay, and in that case, you need to check those two differences. We have already established the breathing and the pulse, right? So we need to check, does this person or this patient has those two basic things? How do you do that? The very first thing is you will check for breathing. Okay? So let's see how we do that. The very first thing is, before you check for breathing, if you're sitting like that, if you just move your neck like that, you will feel that your air pipe from your nose or your mouth, it goes up and it goes down to your neck. Okay? So if it is going like that and you bend your neck like that, you're kind of pressing all that air pipe down, right? Air. So there should be a way to make it straight and make it open. Okay? So imagine if you get up in the morning, you go out in the garden, there's nice beautiful flowers, and you want to just smell those flowers. What you're going to do? You're going to do like that. Like we call it like I'm gonna just take this off. It's easy to just speak without that. Yeah. So you go out in the garden in the morning, and we call it sniffing the morning air. Okay? So you do that, very nice smell, loads of flowers, and you do nice smell, flowers, like that. So you look at my neck, we call it head tilt and chin lift, which is I'm tilting my head, I'm lifting my chin like that. So if you copy that on this person who's lying flat, all you need to do is put your hand on the forehead and push like that. So look at that. If you can't see, you can you're going to come here. So you won't be able to see what I'm doing. So if you press like that, does this person resemble what I did earlier? Like that, okay? So why I've done that? Because we know from anatomy, or the knowledge of anatomy, or how the human body is from inside, if you do that, your air pipe from your nose and mouth, it goes straight. It becomes easier for you to breathe, okay? So we always say, before you do anything, you need to put this air pipe or the air pathway in a straight line, easy for him to breathe. You put your hand there, and you do that, okay? One thing. Second thing now is you need to check for breathing. How we do that is, we call it look, listen, and feel for 10 seconds. And how you do that is you put your face here. Now look, you're looking at the chest, and what will be happening to the chest? It will be moving, okay? Listen, you're listening for the breath sound, the breathing sound, right? So look at the chest moving, listen for the breathing, and feel, look, listen, feel. Feel is the air coming out of the nose and hitting your face, okay? So you put your hand there, like that, you look at the chest which is moving, listen to the breathing sounds, and feeling for the air which is touching your face, okay? While you do that, what is the second thing you want me to check? Which is the life, yeah? The pulse. You take your 3 fingers, at the same time, you do this, and you put the fingers on the neck, on the side, and press and feel for the breathing and for the pulse, okay? I want all of you to take your fingers and put around in your neck, press hard there, and see if you can feel your pulse. Can you all feel your pulse? Definitely, right? Don't put your finger here or here, okay? You won't feel the pulse. If you see that big muscle, this is your air pipe, this is the big muscle on the side. In the area in the center here, you all put your 3 fingers here, okay? You should be able to feel your pulse. Happy everyone? Okay, so exactly in the same area, you do it on the patient. So, I'm going to do it again. Look, chest move. Look at that movement of the chest. Listen for the breathing sound, and feel for the air touching your face. At the same time, 3 fingers pressing on the neck like that. And count for that. Do it for 10 seconds, okay? Now, there are only 2 possibilities here. One possibility is that you see the chest moving, you listen to the breathing sound, and you feel the air touching your face, and also your fingers, you feel the pulse. So if that happens, you are relieved, the patient is breathing, it has a pulse. At that time, what you will do is check the vitals, check the blood pressure, check the pulse, check the heart rate, check the oxygen levels, put some oxygen on, or if you're worried, get the doctor on, and the basic things, okay? But the other possibility is that you do not have the pulse and you do not have the breathing, okay? So if you do not have the pulse, you do not have the breathing, that is a condition where we call it, the word we use, and it's called cardiopulmonary arrest. Cardio means heart, pulmonary means lungs, okay? So remember in the beginning we said there are two things which will go, the pulse and the breathing. So they both are called cardiopulmonary arrest, that both have stopped. If that happens, then obviously that's the time when you're going to do what we are learning today, which is basic life support, okay? So how you do that? The very first thing is, if somebody is dying or very poorly or they're in arrest, the very first thing what you should do, when you see some, if you're on your own, how can you get some help? You shout. You call for help. Well done. Who said that? Well done. Yes. You call for help. Okay. So I've done that for 10 seconds. There's no breathing and there's no pulse. The very first thing will be, I am not going to say help, help, and then looking around. No. I will shout very loudly, help, help, as loud as you can. Okay. Because you don't know, your colleagues might be sleeping on the rest, they might be eating, they're in the toilet. You need to be shouting very, very loudly. Because you need to get as many people as you can, okay? Because what's gonna happen next, you need loads of people, okay? And they're gonna come when you shout. So shout loudly, help, help, help loudly. And then once you are convinced that you shouted loudly, people have heard you, they're coming, you need to start the CPR, okay? So how we do that is, if you just take your hands and just put on your belly here, just press here, can you feel like a spongy, soft bit? Yeah? What is that? Your stomach. Okay? So keep pressing here, keep going up. Yeah, do that please, yeah? Can you feel the hard bit? Yeah? What is that? It's a bone, okay? Which bone is that?
Asim
And it's sternum, yeah. So it's the sternum, the chest bone, right? And from here, your neck is soft, you go down, and then the hard bit starts, okay? So what is that? The hook between this and this. It's chest bone, right? Yes, we call it sternum. You can call it chest, you don't even remember the name. You can call it sternum, okay? So from here to here is sternum, okay? What is in the back here? What's that? The spine, okay? Is the bone sternum hard? It's hard. You can feel it, yeah? How is the spine? Is it soft or hard? It's hard. Okay. So both are hard surfaces. The spine and spine is on the floor. So this floor is hard, okay? And this bone is hard. So there are two surfaces, the sternum and the spine on the floor, like that. In between them is your heart. Now think about a sponge. You all know what is a sponge? You take a sponge and you dip it in water and then take it out. What will happen to the sponge? It's full of water, okay? So if that sponge full of water, you do that like this, what will happen? The water will come out, okay? So you squeeze the sponge. When you squeeze the sponge full of water, what happens? Water comes out, okay? So imagine heart is a sponge, okay? So if you squeeze the heart, what is going to come out? Water, which is blood. So when you squeeze the heart, blood comes out. Where is it going to go? It's going to go across in the body, okay? And that will give you what? You said in the beginning, pulse, okay, yeah? So pulse is that when the heart pumps and the blood goes across, okay? So if heart is a sponge and you squeeze it, it will push the blood out and that blood or water is going to go all around. And that's exactly what you need, okay, yeah? Okay. So, how can you squeeze that heart? Now one way of doing that is, you cut open the chest and start squeezing it, okay? That does not sound like a very sensible idea, right? I don't think anyone here can do that. I can't do it. Maybe Dr. Saab, who is a surgeon, he can do it. I can't do it, right? Okay, yeah? So, you can't cut open the chest and squeeze the heart. What else you can do? Easy thing. if this is your sternum, this is your spine and your floor, okay? This is the heart. If you press like that, what's going to happen to the sponge? You're going to squeeze, okay? And the blood will come out. So how do you, squeeze that? You need to press one of the bones against each other, and you're squashing or squeezing the sponge, and the water coming out, blood coming out, okay? So that is why we press on the chest. Does it make sense now?
Yeah.
So that tells you why we do that. Okay? Okay. So let's see how we do it. You take both hands like that, tie them together like this, like clasp them like that. Okay? Yeah? Okay. Now feel for your belly. This is soft, and then the heartbeat starts. Then from your neck it's soft, and the heartbeat starts from here. Between here and here is your chest bone, which is the heartbeat. Okay? In the center of that, around here. Now you do not need to go and get a measuring tape and start measuring it. No, it is very rough, very random, just approximately from here in the center around here. Okay, so in this dummy, I'm going to just feel from here to here, and this is the center, and that's it. I do not need to be exact in the center, it's somewhere in the middle here. Okay, can everyone see me now?
Yes.
So you put your hands like that. This is your kind of the heart of your hand. Okay, so this bit goes in the center of the sternum like that, and then your wrist and your shoulder comes in one line. Okay, this is wrong. Okay, my wrist and my shoulder is in one line. Do you agree with that?
Yes.
Secondly, this is wrong. Do not bend the elbow. My elbow is straight. Do not bend the elbow, and the wrist and the shoulder in one line, and you press down. How much you press down? We say about 1/3 of your chest from anterior to posterior, yeah? It's about 4 or 5 centimeters. Again, you do not need to go and get a measuring tape to do that. It's rough. It needs to be really, really down as much as you can, okay? So, how we do, and then you start doing it, and how fast do you do it? We call it from 100 to 120 per minute. To make it easy to remember, make it 120 per minute, because it's 2 per second. Heavy? It's 2 per second. So it's 120 per minute, right? So let's lock your hands like that. The end of your palm here, the center of the sternum, and you press and you do it 120 times per minute, like 2 per second, like that. So look at my shoulders and my chest. They're in one line. Yeah, I'm not doing this. This is wrong. Okay, this is right. Okay. Secondly, I'm not bending my elbows. Elbows are straight. And the only thing is moving is my hips. Okay, do not, because that's the only way you'll be able to press that hard. Okay, if you try to do like this, there's no way you'll be able to exert any force. Okay, so do like this, and you do that for how long? Do it 30 times. Okay, yeah, and you need to count loudly. Yeah, so 25, 27, 28, 29, 30. So when it is 30, then remember in the beginning we said we're supporting two things, the pulse and the breathing. So you try to support the pulse, and now you need to support the breathing. How we do that? So, thank you. So, you have that here. Bag valve mask. We call it, there are different names of that. Some people call it embu bag, some people say bag valve mask, right? Okay, yeah. Call it anything, right? Okay, name doesn't matter, okay? So you get that out. Now you put that in the oxygen cylinder, okay? And this bit, the triangle bit, this curve goes on the nose, like that, okay? And now there are two ways of doing that. One is you press it down like that, which is wrong. Do not press it down. Put it gently on the face, and then move the face up into this. This makes sense?
Yes.
Yeah. It's easy to do with two people, right? Okay, yeah? For example, if you just come and help me, please. You just come here. So look, I'm just gently putting it there, and then I'm pushing the face up into the mask, and then now my both hands are occupied, okay? So if, remember in the beginning we called for help, okay? Somebody will arrive, that help, if you ask your help to, you just squeeze that with both hands. Yeah. 1, 2. Do it twice, okay? So you've done that, and then 1, 2. Yeah. And then while you're doing that, do not do this like this, yeah? Look at your own necks. If you do that like this, it's difficult to breathe. you do that, it's easy to breathe. Okay? So while you're giving the breathing, you again push on the forehead, do that, put it on the face like that, okay? And then very firmly you push. 1, 2. Do it twice, okay? Thank you. Do it twice, 2 times. And then you go back on the chest like that. Okay? So you keep on doing 30:2, 30:2. Okay, and you'll carry on. How long you need to continue with that? Well, if you're on your own, you carry on doing that till you get so much tired that you cannot do any further. You have to stop, okay? Or till the patient wakes up. When patient wakes up, he's gonna stop you because this is a very, very, very painful thing. You cannot do it on a conscious patient. If you start doing that and the patient wakes up, he's gonna hit you and he's gonna push you away. Very good, all done. And the third reason for to stop is obviously you get help. You get your senior nurses, you senior midwife, you get the doctors are coming. So once they all arrive, you can just obviously let them take over, and then you can obviously help them. Okay, so it's 30:2 and carry on till doctor comes and they take over. Okay, any questions? Yes. A very good question. So your friend has asked that if you're away from the hospital and you do not have this, what you're going to do? Okay? The very easy answer. The CPR, not CPR, the compression of the chest, that is the important bit. Okay? This is, the research shows this is important, but it is very, very less important. The pressing on the chest is more important. Okay? So if you are in the middle of nowhere where you do not have this, okay, you don't do that. You just press on the chest. Because from research we know that only the chest compressions is the main thing. That is which is going to help the patient. This is not very important. So if you cannot do that, don't worry. Just carry on with the chest compressions because that is important. Okay? Second thing is, if you have a mask of some sort, use that mask and obviously give some breathing as well. Third is, obviously you have all seen or heard about mouth-to-mouth breathing, right? Okay, yeah? So that can be done, okay, yeah? So if you know a patient is not infective, or if you are able to do it, it's your choice, okay? If you want to do it, the ideal way is to give the breathing without a mask is mouth-to-mouth breathing. And the way we do that is, we again bend the neck like that, you pinch the nose like this, you take a big breath in, and you put your lips on the lips of the patient like that, and you push, like you breathe inside like that, and then you, like that, you do it twice, okay? So, head till chin lift, pinch the nose, take a big breath, put your mouth on the mouth of the patient, make a good seal, and then breathe inside. Then take a breath and breathe inside. That is called mouth-to-mouth breathing. The reason I did not mention that earlier was with COVID and everything now, it will be unlikely that you will be comfortable doing that to somebody outside. Especially somebody is breathless and they have cough and they're touching up phlegm and they probably have COVID. You don't want to do that, right? Okay, yeah? So that is why we know from research that the cardiac massage is important. This bit is less important. If you can do it, good. If you cannot do it, don't do it. Make sense?
Yes.
Any more questions
Is there any exception?
for breathing? We'll come in a second. Okay. Okay, so shall we practice a bit of some first and then we move on to children? Okay, let's do a bit of practice, right? Okay, yeah, because once you looking at that is different.